Well, no, like advances as far as like methods, or it's still routine prenatal care, but what we have done in our older women, if they were at the time of birth would be 35 years or older, we've have guidelines and standards of care in those women in which we generally will require for them to be on a low dose aspirin daily until around 36 to 37 weeks of pregnancy. We've required or made it almost pretty essentially mandatory for them to have NIPS prenatal testing done. That's a blood test in which it looks for the fetal fraction cells that are circulated within the mother's blood, where we can test for trisomy 21, trisomy 13, and trisomy 18 to risk stratify the likelihood that they may have one of those chromosomal anomalies. We also co-manage them with the high-risk doctors, in which they do a level 2 anatomy scans, which is a little bit more detailed, looking for structural and like soft markers on ultrasound imaging to know if the baby is developing normally or not. What they generally have this notice that there are a lot of women are having babies later on in age, and they could be from various factors. It could be from having difficulty in obtaining pregnancy until later on in age. It could be from just most women nowadays are focusing on their career, and so they're starting families and deciding to start families later on. And then we've had a few women where they were kind of in what we've termed second stage families. So they had families when they were younger or had children when they were younger. They've either like had a significant time period between wanting more kids, or maybe that relationship didn't work out. They've met someone new and decided to start a family with that individual. So there's gaps in between children. Well, I think as it comes to women, when they get older, a lot of women come in with it with anxiety and thinking that it's impossible or it'll be difficult. And I do believe that women over the age of 35, particularly 40 or over, can have normal, uncomplicated pregnancies and deliveries, and that they really shouldn't come at it with the perception that it's going to be any high risk than the norm because of their age. What they should do is basically maintain be a healthy person or individual. So if they do have medical issues, make sure that they optimize those medical conditions, make sure they're on appropriate medication that could be taken during pregnancy, and that they consult with their OBGYNs as far as their risk and what to expect if they wanted to get pregnant. Well, I think with them coming in and just being open and having an open conversation with us, and then I personally, what I do is whenever I see them for their annuals, I ask about their future family planning goals, and if they wanted more kids, or if they were done having kids, and then it kind of sets me up to have that conversation and increase their knowledge, the fact that it's not as complex or nerve wrenching as they would believe it could be just because they're older. I have more successful, uncomplicated pregnancies and deliveries in my 40-year-olds than I've had in numerous of years, and that's what we've noticed about society right now. I believe the data shows that for the first time in our history and society, that more women are having babies and delivering babies at 40 years old or older than teens.